Yeah, hello, I'm Ryan Iverson. I have type 1 diabetes and celiac disease. My mom had some experience working with diabetics in her past and through her some of a career she was in, and so when she noticed that I was going to the bathroom a bunch, she asked me how often I was, and when I told her, she was very, very surprised, and we went in immediately, and blood work and didn't take very long to figure out what it was at all. So, actually, out of 103 cousins, I'm the only one with diabetes. For a genetic disorder, it seems to be an anomaly in my family. Well, the very first step was I had a battery of medical appointments with a bunch of different professionals. The first day was about there's 5 to 6 hours of appointments. Each one of them with 3 professionals was about 2 hours long, and it was just the crash course. I think I had to go back again every week for the first month, and then after that, they settle you into a schedule of about. You have to meet with the doctor and the educator once every 3 months, and then the nutritionist once every 6 months to a year, depending on how they feel you're handling that knowledge. So yes, I also had to see the nutritionist once I got diagnosed with celiacs. However, that appointment was much easier. She just said, stay away from these 3 things: barley, wheat, and rye. My primary physician, the pediatric doctor who was managing my diabetes, she was just very adamant on testing for other autoimmune diseases, because there's a link. 1 in 10 people with an autoimmune disease eventually develop another. I was diagnosed with diabetes going into my 7th grade year in elementary school, and I was about 69 pounds and 5 foot even, I think, and I grew like a half a foot and put on 30 to 40 pounds, and then after my diagnosis with celiacs, I met up with the rest of the curve as far as height goes, and then I think I standed away in 140 after all that was said and done. In the course of the day, it's hard to always have your supplies on hand, and it doesn't always fit into work schedules or whatever, so it's just trying to make a little time to remember to monitor blood sugar and stuff, because once you get the monitoring down, the rest kind of just comes. The diet is all pretty easy. You just have to learn to carb count, which can be a little bit of a pain, but it's not hard. It's just memorization.
Sure.
Yeah, and they give you a little pamphlets with all the, popular items that you're probably going to eat at first. So you carry that little pamphlet around and you memorize them, and then after a while, now I kind of just look at a plate. I don't even really see what's on the plate. I'm just 74 grams, 68 grams. That's, it's all just in my head. I guess I kind of Rain Man it now. So until I could get the pump, I had to be taking injections. Typically, injections are about 4 times a day. The big thing with injections is you're kind of limited by what your dosages can be. You have to measure it out yourself, which can be kind of hard. There's room for error. Yeah, so whenever I find any of my interactions in emergency rooms, whenever I've had pump malfunctions or insulin not be delivered correctly, it always seems that they are trying to manage my diabetes in the way that my doctors have described diabetes management 20 years ago. They want to keep me above 200. They want to give insulin in response to high blood sugars as opposed to preventing. Typically, I can't. They won't allow me to take insulin on my own. They don't trust me to measure my own insulin, which I've been doing since I was 9. So probably not that risky. A lot of times it seems that when I visit the ER, they hinder my recovery more than they help it. Know your stuff, I guess. There's always new research coming out all of the time, and it's important to stay up to date on that stuff. The other thing is I can't stress how important it is to get in the habit, or getting your clients in the habit of checking more. I know I don't check enough, and I know if my doctors could tell me one more, something else to do, they would say check more, because the more information you can give to your doctor, the better they can help you in response.